Hello, and how are you doing? My name is Tyler Dickens, and I am posting this video for a school project that I'm working on. So, recently I asked several individuals, four instead of three, to assist me with my project. So, their names are Anissa Araujo, Christian Tejeda, Carly Bates, and Lisette Judge Zimmerman. They all gave different answers on when I asked all four of them what their thoughts were on being a healthcare professional. And they gave different answers, and it helped me gain a little knowledge on how they see healthcare professionals, what they might have gone through, and a lot more. Just as for the beginning, these individuals I selected because I know them because I'm in the United States Air Force, as are and so are they. They are all logisticians such as myself. Miss Bates and Miss Araujo are in the traffic management career field. Miss Judge Zimmerman, Mr. Tejeda, and I are all material managers or supply. I know them because we're all stationed together at Aviano Air Base in Italy. I've worked alongside them, and they were all able to assist me with very little problems. They all gave different answers on what a healthcare professional is, and I'm going to touch on that. So, I'm going to start off with Miss Araujo. Miss Araujo, when I asked her what a healthcare professional is, she said doctor, nurse, and physician's assistant. So, that's just her opinion. That's just what she says, and typically that's what a healthcare professional in her mind is: a doctor, a nurse, or physician's assistant. The next person I asked was Miss Bates. Her answers were a little more detailed. She said, when I asked her what a healthcare professional is, she said preventative, curative, curative, and rehabilitative. Now, not to put Miss Bates's information out there, but she's actually trying to become a healthcare professional herself. So her detailed answers are pretty much explanatory for what she wants to do in life. And yes, healthcare professionals are preventative when it comes to diseases. When it comes to diseases, they're preventative in that aspect. They're curative because they have cures, and such as penicillin shots for people with sexually transmitted infections, and they're rehabilitative because, well, at least in the military, we have programs such as ADAPT that help rehabilitate people, and then of course you have people who help rehabilitate people who might be experiencing drug or alcohol or substance abuse issues or domestic violence incidents, or you might have a psychologist who simply wants to sit down and talk with somebody about their problems. Now, the next person I asked was Miss Lisette Judge Zimmerman. When I asked her what a healthcare professional was, she said medication, short term for a long term problem, someone hard to get a hold of, and someone just doing a 9 to 5. Now, medication in reference to a pharmacist. I'm sorry, pharmacists. They do administer medication because when people are in pain or when they're recovering from some type of surgery, they get the medication they need. A short-term treatment for a long-term problem, pretty typical of what we have. Judging by her answers so far, I can tell she's probably had negative experiences with medical personnel because one of the most common medications that one in the U.S. Air Force, at least in my experiences, was given for any problem was Motrin. Now, Motrin, even though it's an ibuprofen medicine, it's not really effective for every type of disease. I mean, if you have an STI, I don't want to get Motrin, I want to get penicillin. And sometimes these short-term medications or short-term treatments that we get, they really don't help out. They're like Band-Aids on a wound. Like, imagine getting a Band-Aid for a gunshot wound. And I know she's also a combat veteran, so she's probably had lackluster type of treatment for maybe a serious issue. Next, she said someone hard to get a hold of. In many different aspects, especially in the U.S. military, sometimes medical professionals are hard to get a hold of. They might have patients they're already dealing with. They might be dealing with training. They might have a commander's call, physical fitness training. Also, medical professionals in the military have families. They have dependents they have to take care of, so they might be busy with that. So trying to juggle and prioritize what is and isn't important can make them a bit hard to get a hold of. Let me give you an example. We in the military have training exercises, so medical facilities sometimes are prone to training attacks for active shooters. So they might be unavailable or hard to get a hold of if they're busy sheltering themselves or participating in this training exercise. Um, I know I had a hard time getting a hold of them during training exercise, and I had to actually wait until it was over to be able to get treated for what I needed. So I see where Miss Judge Zimmerman might be coming from. Finally, she said someone just doing a 9 to 5. The military, like any other job, gives employment opportunities to a vast majority of people. You can be special forces, you can be intelligence, you can be a food services clerk, a cook, you can be a logistician, such as myself and the other four that I interviewed. Um, but for some people, they're simply doing this job just to pay bills or just to pass time or just to keep themselves gainfully employed. I mean, some of these individuals in the military I've met could be on the outside getting themselves in trouble, but instead they're doing something productive by, you know, working their 9 to 5s in the medical career field, for example. Um, and finally, the last person I interviewed was a Mr. Christian Tejeda. His answers were license, job field, patient demographics. So he has a little more knowledge. He's from the Dominican Republic. So a licensed person, obviously doctors are licensed to do what they do. Job field, hey, whether they're a cardiovascular surgeon or anesthesiologist, that's the job. That's the job in which the field that they're in. And patient demographics, so they study the patients that they administer care to. Um, those were his answers. Now, as I interviewed them through Facebook. I asked them these questions, and they gave me the answers they need. And given the answers I gave, some of them have obviously probably had negative and positive experiences. I myself had positive and negative experiences. I remember when I was in high school, for example, I was told I had high cholesterol. At the time, I was working as a grocery bagger on Dover Air Force Base, and I would eat a lot of Burger King, and it was causing my cholesterol to rise high. That's also been a problem in my family, so I had to cut down on Burger King, and at 27 years, I can say that I haven't really had it that much. In Italy, I had it because their Burger King, in my opinion, it tastes better than American Burger King, but I know I need to watch how often I eat fast food because I'm getting older myself and I don't want to have these issues anymore. They did not struggle to find these 3 words, and um, obviously they were able to get the answers they needed. So, again, Miss Bates wanting to be a medical professional herself, Mr. Tejeda, you know, had a different word choice, and Miss Arajo giving the answers she gave, and Miss Judge Zimmerman who gave her experiences, most likely from something negative she's had. Um, like I just explained, I learned from their responses what they've possibly gone through. And the conclusions I can draw from this is that basically Miss Arajo, she was just simply trying to help out. Miss Judge Zimmerman has probably had some negative experiences. Miss Bates is trying to become a medical professional, and Mr. Tejeda was simply trying to help out as well. To be honest, the other four and I, we're all logisticians. Our job is basically managing cargo and personnel on a daily basis. Medical is they're just customers that we deal with when we have to deal with them, or they're people we see when we have medical issues. Um, so I can see how maybe everyone except Ms. Bates probably isn't really that concerned about the medical career field. And how this changed me, it gave me insight into them. It gave me insight more likely into Ms. Judge Zimmerman. I know she's had things that she's gone through in the past, and I kind of guessed it just by her mannerisms, the way she talked, the way she acted, and just the way she came off when I initially met her. And she is improving at the time. Also, we were all moving over to Italy, so you know, PCSing or permanent change of station, as we call it, it can have different effects on people. And I talked to her about these problems that she might have had, and you know, again, I'm glad that she is able to come to terms with whatever issues she had, and she was able to move forward with it. Um, me, my future actions will be to understand that medical personnel, they're people just like me and you. They have problems, they have things going on, and sometimes they might be unavailable for whatever reason. But as long as they're able to do the job that they need to do, I'm completely happy.